Good morning, everybody. This section, we will talk about the impact of aging society and rapid changes of medical technology. And in East Asia, Northeast Asia, East Asia, or Southeast Asia, Japan is the only super age society now. But in next maybe 10 to 15 years or 20 years, all the country here, Taiwan, Singapore, Hong Kong, Macau, South Korea, China, will become a super age society in 10 or 15 or 20 years. So the problem of the aging society in East Asia is an urgent problem. So Mr. William Bishop will talk about the Japan's unique demographic. The problem today in Japan is our problem in next maybe 10 to 20 years. And then Mr. Mishra will talk about the impact of aging and the responses of all the health industry. And then Dr. Wang will talk about the medical technology, research and innovation in Taiwan. And then I will talk a little bit about the health policy in Taiwan and maybe in all the Asian country. And then we will have a Q&A and open to the floor. Then that's the sequence. Then Mr. Thank you, Dr. Wang. Talk about the Taiwan's medical research in Taiwan. I will talk about the government policy, but before that, I will show some the current situation of Taiwan's aging population. Currently, Taiwan is about 15 years behind Japan. It means after 15 years, we will have the same problem in Japan. But in next 40 years, maybe 2050, we will catching up Japan. We surpass Japan. We will become the super aged population in 2050. Because Japan is not so bad. They have 1.4 TFR, total fertility rate. That means a woman can have 1.4 children in her life long. But Taiwan only have 1.1, US 2.1. 2.1 is the right number to have a replacement population structure. And German, they have much lower. But in year 2010, Taiwan have only 0.9 because that year is year of tiger, and this figure 1.1 is because that year is a year of dragon. Then this year maybe lower. That situation is not so bad in Japan because all the East Asia countries like Macau, Singapore, Hong Kong, and South Korea is terrible. Then the situation is terrible than Japan. So in 10 to 15 years, or in China maybe 20 years, the situation will be the same as Japan today. And look at the Western society. USA, UK have no problem, but Italy, Germany, Spain, they have the same problem like Japan in I don't know how many years. Okay, let's see. And the life expectancy in Taiwan will be the same in year 2030. Will be the same Japan today. That means we are about maybe 15 or 17 years behind Japan. Okay, and look at the health expenditure. Why I talk about? Because today we spend let's see, where's the cursor? Okay. We spent 6.5% GDP on health expenditure. And President Ma announced that the GDP will expand to 7.5 during his second term campaign. That means 2012. He said at the end of his term, 2016, the figure will expand to 7.5. But actually, more than that, if you look at the Japan today, 9.5. That means in next 15 years, Taiwan's health expenditure as percent of GDP will naturally expand to 9.5 in next 15 years. It do not have a government policy. The people can. It's a natural process. You don't need a policy. We'll go to, and China today is 5.5, 5.1, but in 20 years that figure will be 9.9, 10 at that time. Okay, that's the point I would wish to point out. The first one is percent GDP on health. You already see that. But the policy of our national health insurance, it naturally will consider of the sustainability of our national health insurance. We had to change it to universal coverage and to provide basic care. Today, current benefit is it's not affordable in next 5, 10, 15 years. Today we call it 包山包海. That means cover the mountain and cover the sea. The sea is the basic care. Mountain is the personalized high-tech health care. But we have to give up something, give up the mountain or give up the sea. But the policy is to give up the mountain. That will be on your personal cost, maybe. And the NHI benefit should be reduced and will be reduced. But the GDP share is still going up. And the long-term care is considered to be the ocean, to be the basic care. So we will launch the long-term care insurance in next few years, and consider the how to say the provider side. The hospital care will be shifted to prevention, home care, and community care. Consider the sustainability of the healthcare insurance. So that's the policy of the government, but it's not easy to do that. But medical technology can help to achieve this goal. And then I think, when is that? In January 1st of this year, 2013, our second generation national health insurance law asks the government to have this health technology assessment. That is already in effect, but the DOH is not initiated the program yet. But this will copy those systems in British or in Australia, the HTA. And then comes to the concern of health industry, the adoption and diffusion of new technology. Adoption is not a problem. The TFDA, I think the staff of TFDA in the audience, they can adopt, they can give the certification for new devices, new pharmaceuticals, but the NHI, National Health Insurance, will include those items into the list, benefit list, based on the health technology assessment. That's the policy. So the diffusion depends on the price. Can we affordable? If not, then that would be on your own cost. That's the current situation. Then I think that's all I know about because I'm not, I stepped down, I'm not the Minister of Health anymore. That's the happiest thing for me.